your health slip, catch a health tip for living the Nebraska good life. Tips for living the Nebraska good life.
Hi Melanie, I'm so glad that you came today. I wanted to take this opportunity to visit with you about heart disease. When you hear heart disease, what does that mean to you?
I think it's just something I need to worry about when I get older.
Actually, a lot of people think that, but that isn't the case. You need to be worried about it now. When you talk about getting older, after you reach age 55, your risk does increase. However, there are ways that we can prevent this before we turn 55. Did you know that heart disease is the #1 killer of women in our country?
Nope.
The fact is, Mel, if you have a heart disease could be your problem. That's why this is so important. There are some risk factors involved in heart disease.
Do you think I'm at really high risk?
Actually, that's a great question. You do have a tremendous power to prevent heart disease. Let's look and see what your risk is now. This machine is called a cholestech. We'll just go ahead and get a drop of blood from your finger, and I'll be able to tell you what your cholesterol is.
Wow, that was quick and it didn't even hurt a bit.
Good, I'm glad. That's one of the benefits of cholestech. It takes about 5 minutes to get your reading, and all it is one small poke on the finger. So let's go over your results, Mel. Your total cholesterol was 138, and we want your total cholesterol below 200. We're going to discuss the components of cholesterol, the different values that also came up from your readings. Your triglycerides came back at 78, and we want those less than 150. So that's a really good value.
What does triglyceride mean?
Triglycerides are actually composed of fatty acids and glycerol. They do circulate in your bloodstream just like cholesterol. However, they're stored in your body fat. When your body needs extra energy, that's what they use. And if your body is able to metabolize fat appropriately, your triglyceride level will be normal.
Well, how do I keep it at a good level?
Okay, keeping your triglycerides at a good level are a reflection of your diet. And actually, the value that you see today is a recent reflection of your diet throughout the past week. So by eating fruits and vegetables, you should get 3 to 5 vegetables and 2 to 4 fruits every day. That can help you maintain a good triglyceride level. Also, by avoiding fried foods and foods high in fat and high in sugar like sodas and cookies and cakes, and processed foods like processed meats and things like that, you can keep a safe triglyceride level. The next component of your cholesterol that we will be discussing is your HDL. HDL stands for high density lipoprotein. You will have probably heard this before. It's referred to as your good cholesterol. It helps remove the bad cholesterol from your bloodstream. Your HDL level is 68, and that is really good because it's recommended that it be above 40. So ways to make sure that your HDL stays above 40 are a healthy diet and lots of exercise.
How much exercise should a person get a day?
Actually, it's recommended that you exercise aerobically for at least 30 minutes. And what I mean by aerobic exercise is maintaining a higher heart rate for the entire 30 minutes. And you probably have heard that referred to as either aerobic or cardiovascular exercise. The next cholesterol level that we're going to talk about is your LDL. And that is referred to as low density lipoprotein. This is your bad cholesterol. This is a fatty substance in your blood that collects along the walls of our arteries. And that can be dangerous because if too much collects along the walls of the arteries, then it makes it hard for blood to travel to and from the heart. And you can get things such as blood clots and higher blood pressure and things like that. So you want your LDL to be below 100, and your LDL is 54. So that's really good.
You know, my dad has a really bad cholesterol and he's on medication. Do I need to worry about that?
Actually, family history is a risk factor. If your dad has cholesterol, you could have it too. And it's been proven that it can move from generation to generation. Maybe your dad got it from your grandma, and then that can be a reason why you would have it. However, it's still important to make good changes and maintain as healthy of a cholesterol level as you can. The next number that we're going to talk about is your total cholesterol versus your HDL. And that's a ratio that's very important when you're analyzing your cholesterol. We want that to be below 4.0, and you're at 2. So that's really good. That ratio means that you have enough HDL to move out the bad cholesterol, the LDL. So that's a very good ratio. Glucose is another test that we got from the Cholestech today. And glucose is known as your blood sugar. And since you've been fasting for 8 to 12 hours before the test, and in that case, your blood sugar should be anywhere from about 70 to 100. But we for sure want you below 100. Your glucose was 84, which is a good healthy range. This glucose can be a determining factor of your risk for diabetes. If you were to be greater than 110, then we would tell you to go see your primary care physician for further evaluation. Diabetes also increases your chances of heart disease. Other risk factors for heart disease are, like we talked about, age, over 55, family history, and if you smoke. Do you smoke?
No. I don't
Okay,
smoke.
that's great, because smoking really increases your risk for heart disease. And stress is another risk factor, and also your blood pressure. Do you know if you have a healthy blood pressure?
I haven't had it checked for a long time.
Okay. Well, we're actually going to take your blood pressure today. Okay, so your blood pressure actually is a number that reflects the pressure in your arteries, the pressure along the artery walls as the heart is pumping blood out. So we don't want your blood pressure to be too high, because that makes it harder on the heart to get blood out to the body and for blood to return back to the heart. So if your blood pressure is 120 over 80 or lower, that's healthy. But say your top number was anywhere from 120 to 139, that's considered pre-hypertension. And on the bottom number, if you were anywhere from above 80 to 89, that's also pre-hypertension. And you should be working with your doctor with those numbers. If you are greater than 140 over 90, then that's considered hypertension or high blood pressure. So let's check your blood pressure right now and see where you're at. Mel, your blood pressure was 116 over 76, and that's a really great blood pressure. Other ways to keep your blood pressure at a safe range are by what we've been talking about, a healthy diet and exercise, and also maintaining a healthy weight. By maintaining a healthy weight, it makes it easier on your heart to do what your heart needs to do, to get the blood out to the rest of your body.
I'm sure glad I decided to come in today and learn about this.
I'm really glad that you came in today too.